Hi everybody, Dr. Sean Casey here with Healthcare Complete Back and Neck Pain Center, answering questions today about whiplash. First and foremost, what is whiplash? Well, whiplash is a type of injury where the head simply accelerates pretty quickly in one direction and then returns in the opposite direction with an equal amount of force. Now, the big problem here is when the head whips forward correctly, i.e. whiplash, all the joints and tissues in the front get compressed, and in the back get ripped, torn, strained. And then we do the exact opposite, coming back this way. So as you can imagine, a lot of muscle, soft tissue damage occur. Now, a lot of times we associate whiplash with car accidents, injuries of that nature, but we see this a lot with falls. We'll see this a lot with sports injuries, where someone's tripped, fallen, and whipped forward pretty quickly. So treatment-wise, what we want to do, number one, is obviously get them feeling better quick. There's some therapies we do to help reduce swelling, reduce inflammation, along with home care to help increase the healing process and get them out of pain fast. Now, the other big issue we have is in most of these cases, the joints of the neck or the back, the areas involved, those bones get pulled out of place, and the body trying to stabilize that for fear the body doesn't know if you broke anything, fractured it, or just pulled it out of place. So to protect it, it starts to shorten and tighten muscles and ligaments to stabilize it, which is a good thing, but it's not a fun thing. So we need to make sure that, number one, we get that soft tissue to heal. So, well, in a lot of cases, we have to do a series of adjustments to get those bones back in alignment and get them to stay that way. We also couple that with things like stretches and traction to increase the range of motion and flexibility of those joints and break down the scar tissue that's occurred. And then some specific exercises to actually help stabilize, protect that area. So not only does it heal properly, but we have normal function, and we're not going to have a re-injury, with just daily activities. So the goal is, how do we get you feel better quick? And more importantly, how do we keep it that way? And that's always the target for those whiplash injuries. Now, in a lot of cases, we'll have patients come in, they've had a minor fender bender, say. There's only a small amount of damage to their car, or maybe none, but they got whipped around pretty good. And a lot of times they'll come in maybe 6 or 8 months later and realize they have these headaches that just kind of came out of the blue and don't know where they came from. We can kind of track it back to maybe that type of injury. So I do recommend, if you've been in an accident, even if it's a small little fender bender, it's always worthwhile to get checked out just to make sure you don't have something going on underneath that can turn into a big problem later. Well, I hope this helps out. If you have any specific questions about these types of conditions, feel free to contact our office. We'd be happy to help. Hope this is a little more information and it'll get you on the healthy side of things. Have a great day.